more expensive forms of creatine are somehow magically more efficient than others. And in order to separate the wheat from the chaff and avoid wasting your money, your time, and your health on the stuff that simply doesn't work, just do the omega-3 index blood test. Levels below 4% are associated with the highest risk of death from cardiovascular disease, and unfortunately, it is quite common in many Western populations. If you have clicked on this video with the thought, the title 3 supplements for everyone sounds somewhat provocative, then I'm totally with you. The advice about supplements ideally should not be generic. It is best given after a full assessment of your medical and family history and a thorough discussion about your personal goals. However, there are 3 supplements that I suggest everyone should be taking unless already doing so. And the reason for that is that they tap into a multitude of physiological aspects related to improved health and performance. Most of us are not getting sufficient amount of them and are deficient. And also, provided we stick with appropriate doses and target appropriate levels, they have a very good safety profile. Number 1 is vitamin D. It is often labeled as sunshine vitamin, but in fact it's a steroid prohormone, a precursor to a signaling molecule which acts directly on the receptors within our cell nuclei and modulates the expression of hundreds of genes. And this way it regulates calcium and phosphate levels in bone health, our mood and cognitive function, metabolism including insulin sensitivity and lipid metabolism, immune system, neuromuscular function, cell life cycle, and more. It is produced in our skin in response to UV radiation, and it is also present in small quantities in some foods. And a notable part of the population in different countries of the world is deficient. To decide if you need supplementation, just check the 25-hydroxyvitamin D levels in blood. If it's below 30 nanomoles per liter, you are deficient. If it's below 50, it is still suboptimal for the best health outcomes. Supplement with appropriate dose, with upper tolerable limit of 4,000 international units per day, recheck in a couple of months, and adjust your dose as necessary, aiming 50 to 80 nanomoles per liter. Also remember that vitamin D is fat-soluble, so you shouldn't take it on an empty stomach with water, but rather take it with or after food, and make sure that food contains some fat to aid vitamin D absorption. Number 2 are omega-3 polyunsaturated fatty acids, specifically DHA and EPA. They are involved in forming the structure of different cells, including brain and retina. They also play an important role in blood pressure and triglyceride regulation, and thus ASCVD prevention, mood and mental health, and as anti-inflammatory. Preliminary studies also suggest that omega-3 may benefit in alleviating symptoms of asthma, migraine, and diabetes, and in risk reduction for certain types of cancer, such as breast cancer. DHA and EPA are present in marine food sources, including fatty fish and algae, and are usually consumed in insufficient quantities. If you were aiming to receive enough EPA and DHA from food alone, you would need to consume between 2 and 550 gram servings of mackerel, salmon, or herring per week. Those of us who are vegans only rely on another omega-3 type, ALA, which is a precursor of DHA and EPA and is present in plant sources like flax, chia, and walnuts. However, the rates of ALA conversion to EPA and DHA vary significantly among individuals, and adequate ALA consumption thus does not always translate into sufficient DHA-EPA levels for optimal health and performance. To check if you're deficient and need supplementation, just do the omega-3 index blood test. This test shows a percentage of DHA and EPA as a part of your red blood cell membrane. Levels below 4% are associated with the highest risk of death from cardiovascular disease, and unfortunately, it is quite common in many Western populations. Levels of 8% and above are associated with the best health outcomes. So if your omega-3 index is below 8%, Supplement with a combined dose of 1 to 4 grams EPA and DHA per day. The average lifespan of our red blood cells is around 4 months, so we recheck omega-3 index after 4 months of supplementation and adjust the dose as necessary, aiming the index of 8+%. Always make sure you buy from a reputable brand and consider choosing triglyceride form as it has better bioavailability than ethyl ester form. Number 3 is creatine. Creatine forms creatine phosphate, which acts as the phosphate group donor to recuperate the energy molecule ATP as it is being spent for energy within our cells. So its main role is to facilitate the function of energy systems within our cells. Most of our body's creatine is stored in skeletal muscle, and some of it is present in other tissues, including the brain. Our body can produce about 1 gram of creatine per day from amino acids arginine, methionine, and glycine. Those of us who are omnivores and consume muscle-rich foods like fish and meat that contain creatine can obtain further 1 to 2 grams per day with food. However, based on the current evidence, in order to get the best health and performance outcomes, we should be aiming more. We should be aiming 5 grams for physical performance improvement and in the realms of 20 grams for cognitive performance improvement every day. There is also no simple blood test to check if we're deficient or supplementing sufficiently. So we just go for a fixed dose every day, for example, 5 grams a day. Don't fall for marketing tricks, because some manufacturers propose that more expensive forms of creatine are somehow magically more efficient than others. Just go for the simplest and cheapest creatine monohydrate, which is not only cost effective, but also health and performance effective. Of course, apart from the 3 supplements mentioned in this video, there's a whole plethora of others that are proposed to sort out all our health and lifespan problems. And in order to separate the wheat from the chaff and avoid wasting your money, your time, and your health on the stuff that simply doesn't work, make sure to check this video, in which I give a clear, simple framework with all the questions you have to ask and all the boxes you must check to always choose your supplements right.